Hello. Multiple sclerosis, or MS, is a condition which affects the nerves in the brain and spinal cord. More than 100,000 people in the UK are living with MS. It is the most common condition to affect the nervous system in young adults. MS is nearly 3 times more common in women than in men. Although it can develop at any stage of life, it is most commonly diagnosed in people in their 20s or 30s. Nerves control everything we do, from how we see and think to how we move and feel. Nerves carry messages from our brain to every part of our body and back again. A substance called myelin surrounds and protects our nerves. It allows messages to travel quickly and smoothly along our nerves. In MS, this protective myelin coating becomes damaged. For some reason, your immune system, which normally fights off infections, decides that myelin is a foreign body that needs to be destroyed. It starts to attack and damage the protective myelin, leaving thickened, scarred areas. Over time, this means that messages can no longer travel smoothly along nerves. This slows messages down and can even prevent them from getting through altogether. It is this damage that causes the problems people experience in MS. It is still unclear what causes the immune system to act in this way. Experts think it's a combination of environmental and genetic factors, such as lack of vitamin D or glandular fever as a child. Everyone's experience is different, but MS is broadly split into 2 types. 85 out of 100 people with MS are diagnosed with relapsing and remitting MS. This means that they have periods where symptoms flare up, which is known as a relapse, followed by times of recovery, known as a remission. Relapses normally last a few days to a number of weeks or months. The length of the gap between the attacks is unpredictable. On average, most people have 1 or 2 attacks a year. A small number of people with MS will get steadily worse with time, without periods of relapse or remission. This is called progressive MS. Diagnosis isn't easy. With a vast array of different symptoms, MS is often confused with more common conditions initially. It can take several months or years to get an official diagnosis. As there is no simple test for MS, your GP will refer you to a neurologist if they think MS could be the cause of your symptoms. You may need some investigations to confirm a diagnosis of MS. These include a physical examination, blood tests, an MRI scan, and a lumbar puncture to remove a sample of fluid from around your spine. If you have any questions, please speak to your GP.